Hi, everyone. We'll get started here in just about 30 seconds. All right, we have a lot to cover today, so we're going to go ahead and dive in. We're going to have a number of presenters with us today. I'm going to go ahead and get it kicked off here, and we're going to start by talking a little bit more about our PCP VBR and addressing the PCP performance measure emails that went out last week. And then we'll be followed by a quick tutorial by Laria Young, our Human-Centered Design Project Manager, who will be talking about our Dashboard 2.0 release and some opportunities for tutorials and feedback sessions for that. We'll have a brief presentation about the low-carb diet keychains and teasing them coming out and getting sent over to you guys, which is pretty cool. And then we'll have another brief admin portal update with Ryan Karpus, our web developer, to round us out for the day. All right, so let's dive in. For our PCP VBR, just as another quick reminder that VBR year is from September 1st through August 31st of next year. And within the admin portal, the PCPs that are approved to earn VBR by BCBSM are now available to be viewed. If you go under people in the admin portal, you'll see a button or a column, excuse me, that says approved for VBR for 2024 to 2025. And so just as a reminder, this was something that we had shared out with you guys previously or earlier in years past, but we had to wait this year to share this out until till now. So this is available on the admin portal as of right now, though. And as for any individuals that were not deemed eligible, the primary reason was because they were not in the fall 2023 PGIP list. And Blue Cross does require that they're in the PGIP list for at least 1 year prior to being eligible. And then the few other exceptions to that was that were physicians who were not approved related to their PCMH status. So those were the main two reasons for anybody that were not approved for VBR for this year. All right. As for the performance measure files, we did send those out last week on 9/6. And so those files, you'll have received a SharePoint or OneDrive, depending on your specific email. It may say one of the two. Should say SharePoint, though. From me, Jacob Reese, will be in the title there if you haven't already opened that. It's not spam, it's from us. That is your PO and praxis performance measure overview. So included in that email was or included in that release, if you will, was 2 emails from Jackie. And in just a quick note on that, there was a revised email sent out later in the day because we did catch a couple of typos. No matter how many times we go through something, there's always ones you miss. And so please do refer to the second email from Jackie later in the day on Friday. But included in that email are 2 files, a data dictionary, as well as an overview of the measure specifics, which has a number of definitions associated with our actual performance files. And so please do check that out and read that. And if you do have questions after you read through that, please feel free to reach out, but hopefully that'll address the vast majority of your questions. All right. And then just do please note that we'll be providing information in our quarterly PO reports to you on your progress. And we are working on including some visualizations of that data and your progress within Dashboard 2.0 to be added to that dashboard before the end of the year. All right. So one of the things that can be a little confusing with the performance measure that we did want to spend a minute talking about, just to make sure it's crystal clear, is the difference between individually measured and aggregate measured practices. And so on your reports, you'll see a combined practice tab. This tab has all of the practices and the rate for the aggregated practices. So what is the difference between an individual and an aggregated practice? So individual practices were practices that had greater than 100 patients in our baseline population. For any practice that had less than 100, we aggregated them together into one measurement unit. That way the PO can provide additional support to those practices that have a smaller base population. And those aggregated practices will be measured again as one unit, whereas individually measured practices will be measured also as one unit, but just they're one practice. And so we did want to make sure that this is clear as it is set up in the files. And so you'll notice here that there is a combined practices tab on the Excel sheets. Anything to the left, you'll see actually on the far left of all of it, you'll have a summary. This will give the overview statistics for your PO as a whole on the top, and then for each of the practices down below. And then to the right of the summary tab, you'll have a tab for each of the practices that are measured individually. So you can see in this example, the internal medicine associates is measured individually. And then after that, you have a tab for combined practices. That combined practices tab is going to have all of the practices that are aggregated together and their overarching summed performance statistics there. Any practices as tabs to the right of the combined practices are the practices that have been combined and are measured aggregated. We provided those so that you have individual practice numbers for those combined practices, so you can see where some of the work could be done. But like say, the performance measure will be based off of that combined practice tab. All right. I'm going to pause for just a moment. Please feel free to come off mute if there's any questions about that. Great. All right. So the other component that we want to make sure we go through here today related to our VBR is the patient needs assessment. So this past Monday, we did mail out to each of the POs with new participating practices, 50 flyers per each new practice. And so those should be starting to get delivered to you either today, tomorrow, or Friday, pretty soon if they haven't already. And so please do make sure if you have multiple new practices joining that you distribute 50 flyers to each of those practices. Obviously, we did mail those to the PO because it wasn't really practical for us to mail directly to every single new practice. And so we are relying on you to do that. We did send an email out to the POs to let you guys know about this. We will be, sending an email out to the POs to let you know about this, and we'll also include a digital PDF version of that in that email so that you have a copy of that and so that you're able to print more on site if you do need more. If you don't have printing capabilities and do need more, let us know. In one-off circumstances, we could ship you more if absolutely necessary. Additionally, we'll also be sending in that email a form when we email the practices, a form to request assisted patient completion. And so this is for patients that are not comfortable completing the survey electronically online using a computer or a smartphone. The options for this will be for somebody from MCTTD to call the patient to complete the survey over the phone, or for us to mail them a paper copy and have them mail it back to us. Please do reserve that for those patients that truly are not comfortable completing it online, as it does become a large administrative burden for MCTTD to do for hundreds of patients. Patients will be compensated for completing the survey, and that will be done via a $15 check in the mail that comes directly from MCTTD. There's absolutely nothing that you as the PO or practices need to do for that. And in the admin portal, you'll be able to track the completion rate of this. So the requirement for this is 10 responses per practice, and that will be reflected in the admin portal and updated on a weekly basis. So keep an eye out for that. All right, so with that, I'm going to go ahead and turn it over to Laria Young to go through our exciting Dashboard 2.0 update.
Thank you, Jake. And if it's all right, I'll just say next when I'm ready for you to move to the next slide. So like Jake said, we're really excited. We just released the first round of new Dashboard 2.0 features and pages. This happened on Monday the 9th, so you should be able to access it now if you want to check out some of the new pages I'll be talking about. The MDC team told me today that if you're having trouble logging in and loading the dashboard, to try to clear the cache and cookies on your browser because there was a big Tableau update that was causing some issues. Jake, if you can go to the next slide, please. So to access these new pages in Dashboard 2.0, when you go to the login, you should now see two options. One will say Patient Data Dashboard and one will say Patient Data Dashboard 2.0. If you click on the 2.0 option, it will take you to our new landing page. And this will be where, as we release new features for Dashboard 2.0, you will always come to find them. Eventually, this will be the landing page for our dashboard overall. But as we are releasing these new pages in stages, we're going to continue to have that legacy dashboard. It will be exactly the same as you've always used. All the features will be there. So please refer to that if you want to go to things like the patient list, patient profile, or your follow-up lists. And know that when you go to this landing page that you see here, this will be for Dashboard 2.0. And so not all the features on it will be live yet. Jake, if you can go to the next page, next slide. Oh, sorry, and one more. So this is what, if you click on that summary measures icon and bar that you saw on the new landing page, this is where it will take you. This is the brand new summary measures page. We've been working hard on this for a while to make sure it has all the metrics that we think are important as part of your participation in MCT2D, really giving you easy ways to see comparisons of your practices, of your providers on all these different metrics. We also have tried really hard to make it easy for you to download reports, which you can now do at the bottom of this page. I'll be talking more about tutorials if you want to learn more about this, but each of the visualizations that you can see here on this page can all be expanded, and you can drill down to see more information all the way down to the patient level. Next page when you're ready, Jeannie. Great. And I want to call out some of the future things that we're going to be adding. One of them is we have this A1C performance measure here. Currently, this is your entire population that has an A1C reported in the last 12 months. We are going to be adding an option as soon as possible to allow you to select to only see your performance measure population, so that you have that option to see, again, any patient with reported A1C in the last 12 months versus the patient population that you're going to be measured on for the performance measure. We're also going to be rolling out pre-populated reports, which we've talked to this group about before, those newly redesigned patient list, patient profile, and follow-up list pages, which we've been working really hard on. They've been designed already with your feedback, and we're just working on the build of them now. Thank you, Jake. You can go ahead. So we also, as part of this, wanted to create a page on our website where we could house tutorials, information, and other important things related to the dashboard. So you can find this now. The URL is on your screen, and I'll go ahead and put it in the chat when I'm done speaking. But you can go ahead and check out. We have tutorials that go over everything from getting started if you have someone who needs some instruction, maybe they haven't accessed the dashboard before, on how to get their account set up, all the way down to how to do the drill downs, how to access the drill downs in the summary measures page. We'll continue to expand this and add to this as we release new Dashboard 2.0 features, but we're hoping this will be a helpful way to get any questions answered. And next slide, Jake. So that's it. Thank you so much, everyone. Again, we're really excited about this. Please reach out with any questions or concerns that you have. Let us know if you have any trouble accessing the new Dashboard 2.0 features, and I will go ahead and put the link to the tutorials on our website in the chat now. Right, thank you.
Thanks so much, Laria. Awesome. All right. Mary Wilson, are you on, and do you have audio with us?
I think I'm on. I'm unmuted. Can you hear me?
We can hear you. Awesome. All right. I have your slides shared.
Yay!
Do you want to go ahead and get started?
Yes, please.
Just tell me your next slide when you would like to go to the next. I'm on the cover slide.
I will. Hi, everybody. I'm Mary Wilson from the University of Michigan Health West Old Metro Health Group. And one of our clinical champions left the spring meeting with, you can do next slide. She left the spring meeting with one of the posters that had all of these panels, so you could do it and people could use the QR code. And she thought, what a good idea. I'm going to cut the poster up and laminate it and put it on a keychain and start having her MA hand them to patients when they came for diabetes appointments after they checked them in, so they could browse those items while they waited. Next slide. So people look and they'd say, oh, one of the things is low carb lifestyle for type 2 diabetes. They'd say, oh, I think I'm interested. And they could scan the QR code. Then she'd come in and each slide, I'll just kind of whip through them here in a moment. So then a lot of people have their smartphones, so they'd QR code it and look at it. And then now they've got it downloaded. Other people, when she'd go in the room, she'd say, oh, you're looking at the keychain. Is there anything that interests you? And they'd be like, yes. And then she would say, you know, did you use the QR code? And they'd say no. And she would then print it for them, that particular interest handout. So super impactful for the patients. So, and got a lot of positive feedback from folks. And then she started this. When was our meeting? It was like March or April. And since then, they've seen what they feel like are improvements for people who engaged with the actual MCT2D support stuff through that simple, hang out while you wait maneuver. And so we approached Jackie to tell her, you guys at MCT2D, and said, hey, we'd really be interested in doing this for all of our offices. At the statewide meeting, they mentioned that they were looking for ideas and they had some money. And so we're no dummies, because we were trying to figure out how we could fund this. And so now, and in a moment, she'll go over how if people are interested, they can actually then get access to this through MCT2D. So go on to the next slide. So the keychain has the low carb lifestyle, the building your plate, which has been one of the favorites. I often hand something out to folks, but a lot of folks who, she said she thought she talked to them about were like, oh, like it was brand new. And then the next slide, sorry. And this one's much harder to read, but for people that, downloaded or we printed it out for them. And then the next one, next slide, the low carb recipes and snacks. And then the next slide, low carb meal plan. And the next slide is the grocery list. And the next slide is the Jumpstart blog. And then the next slide, pretty sure, is the intro to a low carb lifestyle video series. And she was surprised at how many people, like, she'd walk in and they were looking at the video series. So our rock star nurse practitioner, Amra Bristina, and she's just tickled pink. We were playing tag this month, so she wasn't able to do the presentation herself, unfortunately. But so yeah, so we're really looking forward to rolling that out through the whole, through our whole organization. So anybody who's doing diabetes care and is affiliated with MCT2D, having keychains in their room. A lot of people have multiple rooms, so we thought we'd try to get like 2 per provider, because many of us run like more than 3 rooms. So, but even 1 per provider, it will be a big impactful thing. And so we're excited that MCT2D is going to help us and you do this. Are there any questions? And then Jackie, if you'd like to tell them what's next, or whoever.
Yeah, I can take that, Mary. So, yeah, first of all, thanks so much for coming up with this idea and passing it along and thinking of the collaborative. Super valuable, and hopefully it'll be something that's able to replicate all of the success that you've had across the rest of the practices in the collaborative. So, as far as next steps with this, we will be sending out a sample, one of these keychains per PO. And so that way you can kind of see them and show them to your practices and assess whether or not you think it's something that you can work into your workflows and how many you'd potentially want to have. And then we'll actually be opening up a ordering form for both the keychains and for additional posters, normal posters, sometime around the fall regional meeting. So in the end of October, early November timeframe, in order for you guys to be able to place an order for the number that you would like to have sent to your PO. And we'll do the same kind of system as the flyers, where we'll send the orders to the PO and rely on the POs to distribute to the individual practices so that we're not sending 350 shipments. But like I say, you'll have an opportunity to order as many as you'll find to be useful. So we'll have more information on that to come. Keep an eye out for an email about that in October, November timeframe, but you'll be receiving your sample within the next month or so. All right. With that, I'm going to pass it now over to Ryan Karpus, our MCT2D web developer, to go through some admin portal updates. Over to you, Ryan.
Thanks, Jake. Hi, everybody. So I'm going to share with you some of the updates that we made to the admin portal over the summer. There are a lot of behind the scenes updates that we made, but I'm going to show off some of the ones that are more visible and interactable with all of you. And always, if you have any feedback on these things, or if you need help with anything, you can email me and talk to me directly. So let's dive into it and get through it. So first, on the admin dashboard, we've made some changes to the task cards. First, we've added a more info button to the bottom right corner of the task cards for the new PCP VBR year. When you click one of these buttons, you'll see a paragraph or two describing in more detail what is expected for the task, and sometimes it'll just tell you more information will be coming later, and that'll happen if the task isn't really ready to be done yet. If the task can be completed by submitting a form like the PCRA, if that form is ready to be used, we'll have a link to that form right there on the task card. So you can see a link on the slide that says Submit PCRA for the new PCP practices. There's still a link to it on the sidebar, but we have one here too, so it's hopefully a little easier to find things in the portal. The export button on each task card will generate an Excel spreadsheet that just gives you the completion status of each of your assigned tasks of that task type. So for example, you could use it to share a list of people who've not yet completed their learning community requirements. And lastly, just a little reminder on the part that is often confusing about the task card, which is those numbers at the top. And this might be changing soon because I'm working on implementing some UI updates with the help of one of the designers on my team. But for now, note that the number on the left, the red number, represents how many tasks are incomplete, and the number on the right is the total number assigned. So if it says 0 out of 30, for example, then that means you've completed all of them. Moving on. The VBR page, VBR metrics page, is updated to show metrics for the new PCP VBR year. Because we have different requirements for new and continuing practices, you have 2 separate pages for these, and you'll be able to access both of them by clicking VBR metrics on the sidebar. Aside from that, this is pretty much the same as before. This is a good place to get an overall view at the tasks that have been assigned to you. There are some things that you don't see in the VBR metrics, which are included in the PO scorecard, which I will talk about now. The PO scorecards are similar to the ones from last year. This view is important because it shows things that we don't really measure using the task system. For example, your count of type 2 diabetes patients in your PO is something that we will be marking later on when we have that data, and it's important for your scorecard, but we're not measuring that with a task or a form submission, something like that. So this view is important for seeing those kinds of requirements for your PO. This year, starting this year, we also have practice scorecards. They operate very similar to the PO scorecards, but everything here is practice level requirements. So when you click practice scorecards from the sidebar, you'll be able to choose which practice you want to look at. If you click view, you'll get a page just like the PO scorecards. And if you click download, you'll get a PDF that looks like the one on the right side of the screen here. And this is useful if you want to share progress with your practices, especially the ones that don't have accounts for themselves. The tasks list is a more granular way to look at the VBR metrics, essentially. This page is not new. It's not new, but we've added in a notes column next to the status. So if the task is complete, you'll see more information about how the task was completed. This can become relevant when you're looking at learning community tasks, where there are multiple things that you can do to have the task marked complete. For example, someone might have submitted a quiz or they attended some event, and we have another record of that right here on this page. Updating email addresses has become pretty relevant recently, so I've tried to make it easier on everyone to do this. And this is important because we're going to be using emails for more things coming up, which we'll get to. So to update an email address, you first got to find that person in the person list. You can either click on their name or one of their CQI roles. Either way, you'll be able to update their email. If you click role, you'll get the role page from which you can also deactivate the role, which is also relevant. If you click on their name, you'll get to a page where it just shows you all of their roles. Either way, you can click update email and you can update their email from there. And a note on this, if you update somebody's email using this, if this is somebody who has an account, it's not going to update their login email. And that is because I don't want to confuse anybody by having their login email changed by somebody other than themselves. So if you need to update your login email for any reason, go to your account page, which is on the sidebar, and click update email address here. Only you have access to this form, and if you submit this one, this is going to update your login email and your email throughout the rest of the site. Assigning and reassigning roles has been a pain point on the portal, so I've worked to address that a bit here. Previously, if you wanted to change a clinical champion, for example, you would need to deactivate the clinical champion role from the old person and then assign it to the new person. This was cumbersome and required you to go all over the place in the portal to get the job done. Now you can do the whole thing in one form. So when you click Assign New CQI Role, again from the sidebar, the form now has an optional drop-down menu where if you are reassigning a role, you can select the person here to remove the role from them. If you leave it blank, you will not be deactivating any roles, which is sometimes what you want. But if you do select someone here, their role will be removed to give it to the new person. You're also able to add a new person to our database from the same form here, whereas previously you would have had to submit an additional form to add them to the system. And just a reminder to keep our data accurate, please only add a new person if you're sure they're not already in the system. If you've typed in their full name accurately and they don't show up, that's a good indicator that they're not in the system, but please make sure to do that before creating a new person. So we're rolling out a new way of selecting people in your forms. Instead of first picking your PO, then practice, then your name, our new forms are going to have you taking your name first. And the reason for this is so that we can just auto-populate your PO and practice. And as long as everything in the database is accurate, this is going to work out quicker for you and make sure that we have the right practices and everything on our forms. We're also requiring email entry on all of our forms now. This is the email of the person who's listed on the form, not the person submitting the form. And what we're doing with those emails is we're sending out confirmation emails to the person submitting the form to say, hey, we got your form, you got a task marked complete, etc. And it serves as sort of a receipt so that if there's any question about VBR stuff later, we can reference those. And you don't have to have emails memorized every time you submit a form, because if we already have your email, you can just click autofill with your email on file to get through that part of the form. That's all I've got, but we do have some next steps that we're working on. We recently completed an internal user experience project that will be implementing additional changes aimed at the visuals and the usability of the portal. Also, any feedback from you all is welcome. Feel free to email me if you have any good ideas, because this portal is for you. We will be doing PO user experience sessions later this year, which you'll hear more about later. We today sent out an email inviting new clinical champions to create optional practice level user accounts. And we're also going to start sending out task specific reminders 1 month out, 1 week, and 1 day for people who have not completed their tasks yet. Looks like I've got a couple minutes for questions if anyone has any.
This is Kathy Glomsky. I have a question. Back on the admin portal where it shows all the different tasks and who's completed what. I think one more back. Nope.
This one maybe?
Nope. The one that has all the different like yeah, this
admin
one.
dashboard.
Yeah. Perfect. I notice on the physician level, no, let's see, which one is it? Physician survey. There is a due date here of November 15th. I don't see that on the like on the PCP VBR document, and I'm wondering if that is indeed the date that those are due.
The due date should be December 13th. I apologize. I think we changed it and I forgot to communicate that to Ryan. So we'll get that updated on the portal so that it's accurately reflected on there as well.
Yep, I can have it updated within a minute of this meeting.
Yep, so that is my fault. Thank you for catching that though.
And that can that also be added to the I don't know if you want to call it the PCP scorecard document, because there's no due date on that at all. So it leads one to believe that the due date would be the end of the measurement period.
Yep, I will take a look at the PCP scorecards and make sure that when we do have a deadline for something, it's specifically noted in there as well, so that it's consistent across all of our documentation.
Thanks, Jackie.
Mhm.
Any other questions for Ryan? Or for any of the other topics from today? Awesome. All right. Well, thank you all for your attention. We're right at 2:30, so I will go ahead and pass it off to the Inhale team. April, looks like it's you today. Is that correct?
It is, Jake.